In this video, you will learn how to adjust the functional length of the M-Exact Pro partial and total prosthesis. The process is basically the same for both implants. However, we will use the M-Exact partial prosthesis to show it. First, open the primary box carefully by sliding the lid to the left. This is also indicated by the arrow in the bottom right-hand corner of the box. Once the box is opened completely, you will see the M-Exact Pro implant in the adjustment tool. The sizers can be found to the left of the implant in separate compartments. In the M-Exact Pro partial prosthesis kit, there are 5 sizers with different lengths included, whereas the M-Exact Pro total prosthesis kit contains 7 sizers with different lengths. The sizers are made of plastic and are intended for single use only. After verifying the suitable functional length of the implant with the sizers, you can move the shaft in the adjustment tool to change the functional length of the implant. The ruler on the right-hand side of the implant indicates the length. This tool lets you adjust the functional length precisely and without any preset increments. Note that the functional length of the partial prosthesis describes the distance from the head of the stapes, so from the top of the bell's inner curve, to the tympanic membrane. The functional length of the total prosthesis describes the distance from the stapes footplate to the tympanic membrane, and this is the overall length of the implant. The cartilage that is placed between the head plate and the tympanic membrane needs to be considered for the final functional length of the implant. We recommend that the cartilage be 0.5 mm thick. For the M-Exact Pro partial prosthesis, the shaft, and therefore the bell, can be rotated so that the openings in the bell can be adapted in relation to the overall head plate and the anatomy of the patient. Check that the head plate is placed centrally in the tool before you close the head plate. We recommend using delicate titanium tweezers for the following steps. Place the tweezers approximately 1.5 mm along the retainer and in the grooves of the head plate. By using the retainer and placing the tweezers completely in it, the movement will be stable, and you can easily close the head plate. The prosthesis is shipped half-closed, so make sure that the head plate is closed completely before you take it out of the box. Usually, you will hear a clicking sound when the head plate is securely closed. Now you can cut off the excess shaft. Use a new number 15 blade and make a pushing and pulling movement rather than a cutting one. Finally, you can carefully lift and take out the retainer with forceps, a needle, or tweezers. To do that, insert the tool into the retainer's hole. Now take out the implant and put it into the little groove on the right. Rinse the prosthesis with some sodium chloride to remove electrical charge that might have built up. Now the implant is ready to place in the middle ear.